A little more amount of conversation tea about mixed action sympathomimetic agents needs to be spilled over today's morning contemplation sessions. And the center of discussions is amphetamines and its relative drugs. Welcome all to IS Pharmacology Difficult Podcast. I'm your host, Dr. Radhika Vijay, MBBS MD, Pharmacology, and this is the audio hub to get the best simplified basic tips, strategies, methods, and lots of ideas to learn better, understand better, and make your concepts crystal clear. If you really find, and if there's a question hovering in your minds, is pharmacology difficult? Lend your ears for a while and let in the magic of knowledge. Amphetamine in chemical form is better known as racemic beta-phenyl isopropylamine. It acts peripherally on both alpha and beta receptors. It's a potent drug to cause central nervous system activation. The route of drug administration is oral and it's a long-acting drug. Cardiac effects involve rise in both diastolic and systolic blood pressure. There is hardly any effect on the cardiac output, while heart rate is decreased slightly reflexly. In central nervous system, the dextro isomer, which is known as dextroamphetamine, it is a very potent and powerful agent as compared to the L isomer. It activates the respiratory center in the medulla. In the therapeutic dose, the results seen, they are alertness, high energy levels, raised emotional levels like of the confidence, mood, concentration levels. They may level high rarely to euphoria in the normal subjects. All in all, what is going on? The skill and the performance, they are improved, but mind it, accuracy of the work is definitely affected. Drug is abused by the sportsman for the similar effects. Depression too follows if the drug is overused and abused in large amounts. Finally, the adverse drug reactions, they comprise of dizziness, headache, palpitation, confusion, fatigue, delirium, vasomotor imbalance, etc. Generally, the performance is improved before the depression or the fatigue occurs. One can better work at skills demanding constant heed or attention. Sleep is rather deprived or delayed. The sleep pattern is actually interrupted and it normalizes in around 1.5 to 2 months once the drug is stopped. For your kind information, synergistic effects, they are seen along with the opiate drugs if they are administered concomitantly with this drug. And the analgesics, they are also promoted or helped. Respiratory effects include deepening of the respiration and activation. If the central depressants, they are adversely affecting the respiration, then what do you expect? Amphetamine certainly helps to improve the respiratory rate. Amphetamine definitely stimulates metabolism of food. It acts on the lateral feeding center of the hypothalamus to curb the food craving. The explanation of this particular effect owes to the enhanced release of dopamine and norepinephrine. This food intake hampering effect is prone to the rapid tolerance development. So my dear friends, you can absolutely and easily judge and weigh the aptness and the use of amphetamine for weight loss while balancing all its other aspects like abuse and rapid tolerance development. Well, it could be a debate, but clever people would definitely avoid any arguments, right? Now, hope you understand my point of view and opinion also. So, it's definitely a nice time to comprehend the mechanism of amphetamine. Let's do it. Biogenic amines, they are in fact released from the storage in the nerve synapse. The targets are defined as neuronal capital VMAT2, that is VMAT2, and capital DAT, that is DAT. The basic nature of amphetamine prompts mechanisms like reverse transport and prominently exchange diffusion. Monoamine transporters, they are influenced by the production of highly reactive oxygen and nitrogen species and the process of phosphorylation. Harmful effects of these group of mechanisms may be exhibited as nerve toxicity or neurodegenerative disorders. I've already said, just to revise, that norepinephrine is released from the noradrenergic neurons, which defines the amphetamine role in the wakefulness, weight loss, etc. While the release of dopamine defines the activation of locomotor effects, and this requires high amphetamine dose. A novel information is the release of 5-HT or serotonin also on a slightly higher amphetamine dose, which defines the excessive psychic behavior due to amphetamine. Now, all these aspects bring us to the conference about the overdose of amphetamine. The central nervous system toxicity ensues as tremors, a higher level of anxiety, irritability, sleep disturbances, and euphoria. Cardiac complications, they are seen as palpitations and arrhythmias. Gastric complications, they are seen as dry mouth, vomiting, diarrhea, cramps. Further problems with mentally retarded patients, they are aggressiveness, confusion, hallucinations, and fatal tendencies, especially seen along with circulatory collapse, cerebral hemorrhages, convulsions, coma, etc. Again, to revise, there is an initial excitation followed by depression due to amphetamine. Now, how can all these be managed? Well, useful management measures, they are: first, urine acidification using ammonium chloride; second, sedation to alleviate the CNS symptoms; third, antihypertensive use like sodium nitroprusside; fourth, drug withdrawal, it enhances the recovery in the chronic toxicity states; fifth, comprehension of the fact of not mistaking amphetamine as a drug for oversleepiness or for alertness. Hence, it is categorized as Schedule II drug. Next climbing step of discussion, now where we land, is the talks about amphetamine dependence. The chronic use of amphetamine or its dextroisomer results in psychological dependence, and its weight loss benefits are definitely questionable due to the tolerance development. Finally, a word about its applications. As a matter of fact and surprise, FDA has approved amphetamine, especially dextroisomer, for its good results in the treatment of narcolepsy and attention deficit hyperkinetic disorder. And especially I'm talking about the dextroisomer due to its focused central nervous system effects and very rare peripheral effects. So that was a complete detailed overview about amphetamine. Let's talk methamphetamine. So methamphetamine is a relative of both amphetamine and ephedrine. The mechanism comprises of the release of dopamine and biogenic amines to cause inhibition of capital VMAT, that is VMAT, and monoamine oxidase, that is MAO. Peripheral effects like raised diastolic and systolic blood pressure, they are seen with higher doses only. And also there is resultant cardiac activation. The pulmonary arterial pressure and the cardiac output, they are also increased. Having a kind of an abuse potential where the central effects, they are much more pronounced than the peripheral effects. Again, methamphetamine is categorized as Schedule 2 drug. And now you should know one more information. In United States, there are secret labs, or what we better call as clandestine laboratories, where the synthetic production is much in vogue. And hence, methamphetamine is thoroughly used, or rather I should say abused, for recreation, being highly affordable and accessible. That's all about methamphetamine. Let's talk Lisdexamfetamine. Lisdexamfetamine is a prodrug. It is inactive in nature. It converts to lysine and dextroamphetamine. It's approved for the treatment of attention deficit hyperkinetic disorder, that is capital ADHD, in kids, teens, and young adults. And its few accountable side effects, they are dizziness, dry mouth, headache, sleep pattern problems, irritation, nasal stuffiness. Sometimes that may result in upper respiratory tract infection, vomiting, weight loss, etc. With this brief talk about Lisdexamfetamine, let me wrap up today's episode. And we have talked about the mixed action sympathomimetic agents in detail. Well, that deserves a whole round of applause. And with the joy of starting a new topic in the next episode, see you all soon. Au revoir. For all the updates and latest episodes of my podcast, do visit www.ispharmacologydifficult.com, where you can also sign up for a free monthly e-newsletter of mine. It actually contains a lot of updates about medical sciences, drug information updates, and my podcast updates also. You can follow me on different social media handles like Twitter, Insta, Facebook, and LinkedIn. They all are with the same name as Pharmacology Difficult. If you're listening for the first time, do subscribe and follow whatever platform you are consuming this episode. Stay tuned. Do rate and review on iTunes, Apple Podcast. Stay safe, stay happy, stay enlightened. Thank you.